Apologies. I was muted for a bit, so the original video had a bit of an issue. But I'm back. Good evening. So we're going to be talking about the NB.1.8.1 variant, which is a new COVID variant that originated... Well, we don't know exactly where it originated, but it's causing a large wave in East Asia, and it's starting to be detected in the United States, in Europe, and it's moving across the globe. And we're going to talk about how it's going to affect the summer wave, what we should look out for, its variant, its composition relative to other variants before. So we're going to look at it on a genetic tree, and we're also going to be seeing what else we could possibly see from this virus, maybe new recombinations that are possible. I've already mentioned cryptic lineages before, but we could also see other things that could happen with it. We'll also mention how the virus is able to stay around one relative infectivity throughout the year, and why it doesn't really have sharp peaks. Why it doesn't really have, well, not really necessarily sharp peaks, it sometimes has them, but doesn't have super low lows like flu and RSV do during the summertime. So we're gonna start off first by looking at a national picture first, before we get into more details. So nationally, COVID-19 levels are low. They've been declining since the winter, well, since January, slowly declining, but not as fast as in previous years. All results, they are not declining as quickly now as they have been declining off previous waves. The main reason for that is because the winter wave this year wasn't that tall compared to previous years, and even the summer wave last year in 2024. So the amount of people infected in the wave was not the same amount. The wave's height, therefore, didn't reach as high. So we're having a slower come down, as the amount of people susceptible to infection is still great. Well, not necessarily great, but it hasn't been erased by infection to the same degree as a large wave like JN1 back in early 2024, late 2023. How that wave shot up very quickly, second highest wave that we've recorded, infected a lot of people, but because it infected so many people, the amount susceptible to infection declined pretty rapidly, and therefore afterwards the wave really started nosediving, especially after February, where by March we were in moderate transmission and entered low transmission around April before beginning our summer wave. So what we're going to be looking at now is we'll see state trends. So the state that we're most likely going to be looking for is Hawaii. Why Hawaii and not other states? Hawaii historically, at least when we are looking for COVID transmission, especially when we're looking for the summer wave, not necessarily the winter wave, but the summer wave. When Hawaii starts its increase in infections in the spring, that usually is a warning sign for the upcoming wave in the actual continental United States. There's a bit of a lag. So last year, for example, Hawaii's wave was in late June, the peak of their wave, but their wave started in April, right as we were in this low period. And then, as Hawaii was declining, the United States, continental United States, was rising, especially the western and southern states. Whereas Hawaii usually during winter has lower transmission overall. But usually before our summer wave, Hawaii is usually our first warning sign before we see anything happen within the continental United States. As far as we're looking right now, COVID-19 transmission in Hawaii is in moderate. It's higher than where it was, but we haven't really seen past this moderate points that we've gotten in mid-April. We haven't really seen it start increasing back to get high and further. But this may be coming sooner than you think. So we'll keep an eye on this. When this starts going a bit more vertical, and instead we're facing a trajectory where it's more like this, it doesn't have to go that sharply up, but more of an upward direction. Then we'll start paying a lot more attention to this to see, okay, the wave is really cementing itself in Hawaii. Then there's only a certain amount of time before we look nationally, and we're going to start seeing this map that right now is in this greenish cyan color turn into more dark blue over time, especially the west and the south. If I could draw that better, draw the south this way, especially the west and the south. Anything west or south of this blue line, especially those areas, because this winter they did not have a significant not a significant winter wave. They did not have one. They had a very large summer wave, but they did not have a significant winter wave. So a lot of people are susceptible because they did not get infected over the winter. And because we have a new variant that also increases susceptibility. And at least from anecdotal reports, at least from what I'm seeing online, NB.1.8.1 is spreading quite quickly in East Asia. So we're going to have to see exactly once that variant of virus gets more dominant in the United States, how exactly it's spreading and what areas that we need to watch out for. Currently, there's higher transmission according to sites in South Dakota and Mississippi. This may be due to a lack of reporting, but just so you know, even if there is a lack of reporting, no real place in the United States transmission is low enough not to take precautions. It's just that it's lower than where we have been, which is a good thing. Now, switching over to the actual NB.1.8.1. It's still hard for me to say, so I'll use Nimbus instead. But Nimbus variant, the track of variants before it, if we look at it this way, NB.8.1 is down here, and there's been recombination variants of different variants combining. This is the evolution of COVID-19 up to this point for this variant specifically. So BA2 was the second Omicron variant that trailed BA1, which was the first Omicron variant. That first variant has practically become extinct, but BA2 has continued on. So we've had BA2.86, which turned into JN1. This was a variant from a chronic infection, whereas these other variants up here, these were for community transmission, and XBB was a recombinant variant BJ1 and NB.1.8.1. So this became XBB, or the Kraken variant. And then these variants have also diverged. And we had XDE turned to XDV, which is the variant that's been spreading in mainland China for a large amount of late 2024 and in the winter, and that has evolved into NB.1.8.1. Now what we're looking at now for the upcoming year, at least I'll read the tweet. The last variant to receive an informal name was BA2.86 Pyrola nearly 2 years ago, August 2023. I remember when people were talking about this variant. This at the time was a highly divergent variant, and we first noticed this one back in August, and then JN1, which was a mutation of it, later, and this spawned the large winter wave that you see. If I could pull it up, it should be here. If I look at national trends, this spawned the large winter wave that you see here. Okay? So, going back to the tweet. Since then, it's been a prolonged variant soup phase. So, variant soup just means that we've had a lot of different variants of the virus, all from the same lineage, but lots of different variants of them, all mixing together, but we haven't had a single dominant new strain come in and wipe out the variant soup phase. I'll show that on a variant wastewater map soon. So a prolonged variant soup phase involving the Pyrola clan does not mean that there was no within host evolution occurring. This is important to note. Variant soup, at least in this context, was the virus transmitting to the community and breaking up into different variants that gain their own new unique advantages. This is what helped with making the summer 2024 wave possible, because a lot of different variants that spawn off JN1 here lined up all at once to produce back-to-back waves of differing variants that led to the summer 2024 wave. However, that didn't stop any evolution from within people who are immunocompromised from developing new strains of the virus within them. That did not stop. We just haven't seen anything so far jump out of them until right about now. Nimbus NB.1.8.1 gets its name from the type of cloud. It's not irrelevant information, but it's nice to know. Is not just another member pyrola. It's a triple recombinant. So as far as we see, recombinants of JN1 and XDE, which itself is sourced from XBB, which is Kraken. It's a term that T. Ryan Gerber gave it. And this is where we are now. So it's not just an offshoot of JN1 or pyrola the clan itself. It's a completely new strain with the characteristics of all of them. So it has to be treated differently if we're looking at a genetic tree. Now, it has spread through Asia. I know in Hong Kong some pediatric wards were overwhelmed. It is spreading in India pretty well. So it's already spreading well in East Asia, and it's escaping East Asia. So now we have to see what it does in North America, Europe. Even though I focus mostly on North America, we have to see what it does in North America, Europe, South America, Africa, and Oceania. There's this video here, which I'll play in a little bit, and I'll cover the vaccine situation here now as well. So, in terms of current vaccines, Moderna and Pfizer target KP2, which is JN1.11.1.2, and Novavax targets JN1 proper. LP8.1, as you see here, is the dominant variant currently in the United States. The current vaccines are better at dealing with this. However, NB.1.8.1 is an offshoot of this, so it's less affected by current vaccination. So new vaccines have to be created to be more effective against it, or vaccines specifically for LP8.1 would need to be created to at least reduce the effects that NB.1.8.1 will have on the immune system. Simply because if the immune system is able to recognize the variant faster, the variant's not going to have the time to solidify itself in the body, promoting an overreactive immune response that could kill the host. And that's not what we want to happen. That's what happened in the first 3 years of the pandemic, where most people, it's a novel strain, people haven't seen it before, so the immune systems are slow to react initially. It takes time, the virus builds up, and then the virus gets enough of a foothold where the immune system begins overreacting, and you get the cytokine storm and immune system reactions that lead to death. It's been happening less and less as people have already been infected or have had a vaccine, so they're more able to stop the virus early in the acute stage, but that doesn't necessarily prevent long-term impacts, but it does help in preventing severe illness and death. So we're going to continue talking about, talk about this statement from Secretary Kennedy. So I'll play the video for everyone.
Hi everybody, I'm Robert F. Kennedy Jr., your HHS Secretary, and I'm here today with NIH Director Dr. Jay Bhattacharya and FDA Commissioner Dr. Marty Makary. I couldn't be more pleased to announce that as of today, the COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule. Last year, the Biden administration urged healthy children to get yet another COVID shot despite the lack of any clinical data to support the repeat booster strategy in children.
That ends today. It's common sense and it's good science.
There's no evidence healthy kids need it today, and most countries have stopped recommending it for children.
We're now one step closer to realizing President Trump's promise to make America healthy again.
Produced by the U.S. Department of Health and Human Services.
So that was the video. So the main thing that this affects is, number one, because it's not going to be covered underneath recommended immunization, Medicaid is unlikely to cover it, and that means insurance is unlikely to cover it. So pregnant women who are trying to get a COVID-19 vaccine, they will likely have to pay out of pocket, which most Americans cannot afford to pay for medical treatment out of pocket. And that will most likely mean they won't receive a vaccination. So when they do contract COVID-19, it's more likely that they'll have less of protection against a new variant, but also it'll be harder harder for them in general to stave off long COVID, because the vaccine does help reduce long COVID to a degree. Not significantly enough not to worry about the virus, but enough to where it reduces it by at least half. We'll also have to consider that because they're not getting a vaccine now, the main way that they're going to build up immunity, well, not build up immunity per se, but build up resistance to the virus will be through an infection, which does carry the risk of long-term impacts, as I already mentioned. And because they're not vaccinated on this time around, depending on how long their previous one was and how long their previous infection was, that does increase the risk that the immune system does not stop the virus early enough, and that could lead to the immune system overreacting to shut it down, which could lead to hospitalization and potentially death if things go too far. Other things that we'll talk about, so at least from the actual graph here. So JP Wallen posted this on May 21st, so about 6 days ago. So according to current data, and this is where our winter wave was. We were summiting around 600,000 infections a day at peak in early January. We have slowly come down over time, slowly. Not as quickly as in previous years, but slowly have come down. And we're expecting it to bottom out based on the past data, because wastewater data is usually at least a week or two behind. We're expecting it to plateau right around now, which is our time period, and then gradually should begin increasing again, or decreasing slightly depending on how long it takes NB.1 or XFG to really gain advantage in the United States. Now, a reason for the higher scenario will be the XFG or NB.1.8.1, or both of them, have a higher growth advantage than initially thought. So this will cause this wave to start increasing faster. So you notice the wave started to pick up quite quickly as we enter June. Well, not June specifically, but as we enter late June into July. Currently, the most likely estimate is we start increasing, but we're not really going at the exponential growth. Well, that's wrong to say. We do have exponential growth here, but we're not at the point of the graph where it starts going sharply up like that. We have this increase where it's starting, but it's slowly starting to get there, where you start seeing this having a more vertical component than horizontal. Then we'll really see how much room there is for this wave to really grow, depending on new variant evolution. And so a lot of surprises could happen depending on what happens this year. So generally, we're looking at around, by this time, if JP Wallen's forecast is correct, which it usually is, we will be looking around 300,000 infections by late June of this year. This only goes out a few weeks, so the farther out we go, the less accurate it will be. But his track record has been pretty good with his forecast following the lines pretty effectively. So if we start around 300,000 infections by June, we'll be well into our way into a late summer wave. Summer wave that could peak in either August or September. Now, he does mention uncertainty. So uncertainty still lies with XFG and NB.1.8.1 advantages, look like in the US. That's important, and the timing is also important. So, if the variants reach dominance at different positions, that can make the wave larger. Similar to last year where you had KP2, closely followed by KP3. So one wave over the other, in terms of the variant's dominance within the population, keeps infection rates high. But if they both peak at similar times, then that means then that could mean maybe the total infections could be higher. Although I might be wrong about this. Total infections could be higher one wave, but it comes down a bit sooner. We have to see what it looks like. But this is the general growth advantage over other variants, at least in New York State, that we have right now. So SFG, the most likely, is 65%, but we have a confidence variable of either 80% at the high end or 50% at the low end, for example. So we'll watch this. We'll see how large the growth rate really is once we get a few weeks out from now. I'll continue to try and make more updates, even though I want to resume college soon. Get more updates out and make sure that people are informed about this. Now, I will show the video about this variant spreading globally. So I'll show it here. And I'll zoom in. This is NB.1.8.1, PK1, and PK2 sampling. So we start in the UK, but as we expand out, you notice infections in China and in East Asia in general, Indonesia, Thailand, Australia. Start seeing samples in the United States. The main issue here is that a lot of samples coming from East Asia indicate that this area was likely undersampled, so that more sampling needs to be done. But we already have detections within Western Europe, Scandinavia. This looks to be Russia, St. Petersburg, and the United States. We already have detections. However, we haven't reached variant dominance yet, which is still plenty of weeks away. So this is a general spread that we've seen. We'll keep it going towards the end. So this is a general spread that we've seen so far. We'll keep you updated on this. And this is the global genome tracker. It's from what we've seen. So globally, XDV is down here. So let me get rid of that. XDV is down here. This is the variant that impacting China. XEC is gradually going down globally. That was the winter's leading variant, but it's rather weak. JN1 proper and its ancestor BA.2.86, they're slowly going down. And then we have to see what else comes up here. We'll have to see what the XCV and LP8.1 does. LP8.1 is going down, but NB.8.1. Well, XCV is NB.1.8.1. Let me correct myself. This one is increasing, so we'll see what happens with this eventually as time goes on. Forbes did make an article about this where they described the variant being detected in the U.S. So they talk about vaccination here. COVID-19 vaccines available right now contain even spike proteins, Novavax, or mRNA codes for spike proteins, Pfizer, Moderna. If you prefer less side effects, I would take Novavax over Pfizer, Moderna, but you could take either one. It might be harder to get Novavax vaccines, however. These updated vaccines were first rolled out last fall and targeted the KP2 variant. Descendant of JN1. With vaccines to be available this fall, there have been talk of even no changes or updating with LP8.1. Current vaccines provide some protection against NB.1.8.1. You get better protection with one targeting LP8.1 because they're more similar. Now, obviously, politicians are not really doing too much about this in the United States, so don't expect too much guidance from the federal government within the next few months about this. But this is true down here. SARS-CoV-2 isn't the same threat that it was in 2020-21, in large part because your immune system is more used to the virus. The virus has not gone away or become harmless no matter what politicians may try to tell you. So this is true, in a way, because deaths and hospitalizations have declined 15 to 20 times since 2020 and 21 because people have had their first infections already. Their immune systems are used to it, so they can attack the virus faster than with no infection prior, where it lets the virus sit and then it overreacts. So it's not the same threat, but we're still losing about 50,000 Americans a year confirmed with death certificates, not including those from excess deaths, which are slightly higher. So it's still nothing to scoff at. We're still losing a lot more people to it than the flu, but we're a lot better than where we were 2 years ago. Additionally, I will actually look at the... Where is it? Not this, although this does explain my earlier point a little bit. If I can look at hospitalizations over time. If it will pop up for me. I said if it will pop up for me, but I don't know. There was a better statistic, but it's not working that well, unfortunately. I'll come back to this when I have better information. when I have a better handling of this website, rather. Now, this will be the final part of the video for next strain. So, this is the current, well, SARS-CoV-2 phylogeny. I need to say this word better. But this is its evolution, essentially, over the past 5 years. Encroaching on 6. It's more closer to 6 years than 5 years. But NB.8.1 is, I believe, this one. If we look on the tree, Omicron is up here. And a lot of these are Omicron lineages. But they're so far away from where the original Omicron was down here that these are practically their own variants. These are their own variants. They're not the same as Delta or any of these. They're on their own trees entirely. NB.8.1 is here. Now, with XFG and NB.8.1, they're 1.81. There is a chance that some variants that they may intermix and there may be some recombination of variants. That doesn't mean that they'll be more effective at spreading. As we know, XFG is better at evading the immune system, while NB.8.1 spreads faster. We do actually have to see whether any new evolution via convergent, where two variants come together, or divergent, where you have a variant that exists within a human or a person or animal, and then it evolves into new variants later, and then we get a hyper divergent variant, a highly divergent variant here that eventually jumps out. We have to see what happens there. But this is the current tree, and NB.8.1.8.1 is here. So it's quite far away from our original variants, and it's quite divergent from where we were before. So we'll have to see from this. Are we going to see more? We will likely see more variants come off this offshoot branch. We will probably see this become a dominant variant. We're going to see a large amount of new variants, as we saw with JN1 down here. A lot of variants JN1 produced. But we'll see. We'll see how many variants we get, and we'll see what the future of this virus looks like. But the main things that I will say for this upcoming summer, at least from what we're about to see, I will also cover this a little bit, because the effective reproductive number should go above 1 for this wave to start, and I'm not sure where it's going to peak, but it shouldn't go much higher than these other values. But what we will see is that when this reproductive number increases, we need to see how high it gets and how long it stays here, because that will affect the shape of this graph here. So I'll get a 1 year graph out. So I'll get a 1 year graph out. Do we see another summer wave? Do we see a summer wave similar to last summer, where we get to very high transmission in multiple areas of the country, where we have high transmission in the west, the south, and lagging transmission in the northeast and midwest? What type of summer wave do we see? Do we see a shorter summer wave, similar to 2023 here, where we reach high transmission, but the infection is not as high as like winter wave level as last year? What type of summer wave do we see is a big question, because we're starting out here, which is around where our previous lows have been. So we're starting around there. It just matters how high can we go based on the variants that we see. So the timing of the variants is number one. How do the variants sync up together? How effective are they really going to be within the United States? How many people get infected? What does the immune landscape in the United States looks like to affect who's susceptible to infection this year? Because on average, people get infected by this virus every 1.5 years, with some people earlier and some people shorter time spans and some people longer time spans. So you have to see, what does the shape of this wave look like? If the shape of the wave looks more like this, similar to last summer, then you'll have a very long period of high infections. Probably not super high height. Not super high height, but high enough where you have sustainable transmission, over 800,000 infections a day, maybe, for at least a month or two. And then it slowly comes down into the fall. But if we see maybe a new variant that's the version emerge here, then maybe it doesn't go down this far. Maybe we see another 2022 scenario. We have a large wave here, a brief low here, and then another large wave right here. And then we finally get a break in 2026. We have to see exactly what happens this year. What new variants we get, how they sync up together. Do we have multiple variants sync up like this? And then it comes down, and then we have another variant come up like right behind it, and that leads to a wave that looks somewhat like this, like last year? Or do we see one where we have one leading variant dominate, and it looks something like this, and then is divergent enough, and we get something here that arrives in the summer, but it's not dominant yet, and then gives us a larger wave like 2024. We really have to see what happens. Here's my main takeaways. Make sure that you're preventing illness as best you can. Keep an eye on your wastewater data in your local community and just see how this virus evolves. What new variants arrive, what the immune system landscape looks like. Follow JP Wellin on Twitter, Ryan Gregory. Follow these sources. Get the information that you need to make the best decisions that you can. I'll try to make videos as well. But get the best information you can. Look at the CDC website. Use this information to extrapolate what's going to happen within the next few weeks. And then prepare for it. This year is a bit different from other years because we haven't had a small winter wave like this compared to previous years, where a decent amount of the country was not infected over the winter. And we're at a point where we have a new variant that's somewhat divergent, that has a decent growth rate. But we're also entering a period where there's less vaccine access and even less government action to prevent disease. Even under Biden, for example. Late Biden's term, not early Biden's term. Okay, guys, I think I covered everything the best I could. I will try and make longer videos of this on my second channel, Isaac, which I can pull up for you guys right now. I just have to give me a second or two to actually do so. I can't actually pause the recording, so that's actually my fault. But Isaac, I will actually search it up. It is a second channel that I have right now. So this channel, I post infectious disease updates here. I want this channel to grow large enough and have enough watch time where I can start streaming from this channel and give better live updates and speak to you guys directly. But subscribe to this channel for longer updates. This is where I'll go more into NB.1.8.1, new variants. We'll also go into other infectious diseases like influenza and RSV. However, I'm not really going to be talking about these too much in the United States, because this is not their season now. The wave over the winters has already happened, and we're in this long summer stretch up until about late fall where they begin surging again. So the main thing that we're going to be talking about for the next few months is going to be COVID-19, and then as fall begins and we get later into the season, then we'll start covering influenza and RSV again, and we'll start looking at other diseases that transmit the best at that time. Alright? Hope everyone had a good day. Has a good day. Hope you found this video informative. Please make sure to like, subscribe. This is being posted to the main channel. And yes, please make sure you protect yourself. Use the resources I have. Look at these links. And yeah, take care. Thank you for watching.